Commissioner Ham, on that point you made about and how information will be shared.
Correct.
Have you or the department researched what information they're talking about when they're saying shared information?
Chairman Kaiser, Representative Casper, that's really a question for HHS. That's still being determined. We don't know at this point exactly what types of information they're talking about, how it's going to be shared. And again, what HHS is saying is there's going to be a memorandum of understanding, an actual kind of contract between them and any state doing a partnership, both on plan management and consumer assistance. And so what you find out from HHS is that that memorandum of understanding may be different from state to state. And so on your question of what information will be shared, in some ways that's going to be between that individual state and HHS, and what they would agree will be part of the memorandum of understanding. Okay?
Committee members, and we'll continue. We're going to pass out a handout, which is a roadmap to the partnership. And you can look at it, and it shows all the options that if you had a memorandum of understanding, the department would sit down and say, we will cover A, B, C, D, whatever, but not the other functions. It would be an optional thing, I believe.
And the options would be underneath the headings plan management and consumer assistance. To date, those are the only things that the feds are saying. If we're running the exchange, we'll let you state run these. Because remember, it's not a state exchange. It's a federal exchange that they're partnering with the states on a couple of limited issues on. The most important part about the partnership option is the funding hasn't been figured out yet. Who's going to pay for what? And until the funding issues have been sorted out, to me, it's difficult to even properly analyze whether this would even be something we'd be interested in, or any states would be interested in. By the way, that's a big part of why you've had a grand total of one state say they're interested in doing it.
Okay.
Should I continue?
Continue, please.
Back to the B section on page 6. I was asked to address whether any changes can be made to an exchange when a state lets the federal government set up and start running the exchange, and then later the state takes it over. The question is whether the state would be able to change anything in the exchange that the federal government had set up. The regulations on exchanges require that a state wishing to take over an exchange that was started by HHS submit a transition plan and have it approved at least 12 months before the change. And these regulations from HHS also address that there may be differences between a federal exchange and a state-run exchange, and specifically mentions that the state plan must include a transition to the, quote, new rules. Further, the preamble to the interim rules on exchanges shows that HHS understood that changes would be likely. In paragraph A3, we propose that such a state must work with HHS to develop a plan to transition from a federally facilitated exchange to a state exchange. We anticipate that this would include the smooth transition of operational functions from the federally facilitated exchange to the state exchange, including transitioning enrollees from QHPs certified by the federal facilitated exchange to QHPs certified by the state exchange, which may or may not differ. Also, the preamble to the final regulations shows that HHS continues to believe that changes would be likely in the transition from a federally facilitated exchange to a state exchange. Suggestions for the transition plan included the demonstration of consumer input and tribal consultation, a process for educating consumers about potential changes, process for ensuring QHP issuers have sufficient time to comply with new standards, such as a 1-year grace period, and a plan to protect enrollees from lapses of coverage. A number of commenters recommended a state-based exchange starting after 2014 must have similar or better levels of insured rates, affordability, covered benefits, and administrative simplicity or quality of services. And that comes straight from the regulations. So, while there may be some ability to make changes regardless of the implementation model, state-based, a partnership, which is a federal exchange, or a full federal exchange, exchanges must still ensure that the core functions are carried out in compliance with PPACA. In other words, there may not be a great deal of variation between a federally facilitated exchange and a state-based one, because all exchanges will have to perform the same basic functions. Lastly, and at the bottom of page 7, regarding this entire issue of exchanges, I wanted to make sure that my position was out there. It has been consistently very straightforward. Because of all the fiscal, regulatory, and political uncertainty that surrounded the exchange issue last fall, specifically November, I agreed with the North Dakota Legislature's decision during the special session not to build and run a PPACA-compliant exchange. Well, fast forward 8 months, and all the uncertainty still exists. Fiscal uncertainty still exists, as it's unclear whether the exchanges will be able to pay for themselves or will become a money pit for states, as I talked about just a few minutes ago. The important deadline is January 1, 2015. They have to be self-sustaining after that, no federal money. So a state taking on this burden has to be sure that there's enough money coming in the door every month to pay for the expenses of the exchange on a month-to-month basis. This is not a situation like the exchange is a business, but it is not like a typical business. A typical business, when you open the doors, if you're not having as many customers as you thought, you have to make business decisions, including potentially reducing your employment, your staff. That can't happen in an exchange. What's happening January 1, 2014 in the exchange will have to happen July 1, 2014, October 1, 2014, January 1, 2015. The operations have to keep rolling. Okay? So you can't make typical business decisions with the exchange if it's not bringing in enough money to support the expenses that are going out on a month-to-month basis. So that is a huge amount of fiscal uncertainty, which, by the way, is the biggest reason why, to date, you've seen a grand total of 14 states say that they're going to build and run their own exchange. And when you look at the list of states, it's a who's who of states that we don't have a lot in common with. California, Connecticut, Vermont, Rhode Island, Massachusetts, Hawaii, and on the list goes. Okay? Regulatory uncertainty still exists, as all the rules and regulations regarding how the exchanges must be run have not been set by the federal government. And this is a very important point. We're 2.5 years into this law. March 23, 2010 is when the law was passed. We still don't know what all the rules and regulations are regarding how the exchanges have to be run. They're hopeful to have all the final regs in place by the end of this year, by 2014. But here's the kicker. The law allows them to change the rules at any point in time after 2014. And any state that says it's going to build and run its own will have to comply with those rules and regulations. Okay? So we're in a situation where the rules of the game haven't been set yet and may change after a state were to make a decision. And then lastly, political uncertainty still exists, as the law may not survive depending on the results of the November elections. I'm sure most folks in the room already know this, but one of the greatest impacts of the Supreme Court ruling was by it now saying that it's not the Commerce Authority that allows the penalty under the mandate, it's the taxing authority. There no longer needs to be 60 votes in the United States Senate to repeal any portion of the law that has a fiscal impact. You now only need a simple majority. So, if Mitt Romney were to beat Barack Obama this November, if the Republicans maintain control of the House and get to at least 51 votes in the Senate, it's very likely that substantial parts of this law, if not all of the law, will be gone in a few months. Okay? So further, my opinion has not changed that the North Dakota legislature made the right decision not to build and run a PPACA-compliant exchange. And then lastly, and this is to me the punchline, based on what we know now, even if the law survives after the results of the November elections, there is so much fiscal uncertainty regarding the exchanges that the best course of action among a bunch of horrible options available to the states would be to make the federal government prove that they can make the exchanges work. Let them prove to us and to other states that exchanges can actually work financially. If they can prove that, North Dakota could, if it wanted, take over the exchange. Any questions on that?
Okay, Senator Mathern.
Thank you, Mr. Chairman. Commissioner, it appears the objection to the partnership model relates considerably to the fiscal implications. What if we were to assume that a partnership model actually involves the general principles of partnership, wherein both partners have skin in the game, wherein both partners, while coming up with one product, pay for parts of the product that relate to their activity. And the activity that would be undertaken by the state and the activity undertaken by the federal government is kind of spelled out here. And then we assigned the cost of those activities to that partner. What then would be your point of view on this issue of going into a partnership? And one of the reasons I ask you to consider that is it appears a partnership might create some benefit too in terms of the later stage of maybe wanting to take it over, wherein we would become much more proficient in the process. So I appreciate some comment on that. If the fiscal matters were in fact assigned to the parties in the partnership.
Chairman Kaiser, Senator Mathern, while I understand your question and your comments, the premise of your question requires me to give you an answer that that you're not going to like. Okay, and the premise is if the financial issues can be resolved in a way that would be mutually beneficial or mutually acceptable to the parties. I haven't seen anything with respect to the partnership model that would lead me to that conclusion. All the fiscal uncertainty that I just talked about is just as much there for the partnership model as it is there for a state-only built and run exchange. And what I just said in terms of, to me, the best course of action would be for the federal government alone to prove that they can make these things work before the state puts any financial commitment to it. Okay? Remember, what we've been told so far is any state that chooses to do a partnership will have to enter into an MOU, and they haven't figured out how it's going to be paid for, who's going to pay for what. So until that is completely sorted out and you can analyze fully what that means, it's hard to give an answer. But even more than that, even if that does get sorted out and you figure out who's paying for what, if we have to pay for any of it, then you get right back to what I just said. I've been looking at this issue now for over 2 years, studying it, watching what the rest of the country is doing, listening intently to what HHS is saying and not saying, and I cannot find a compelling enough reason for this state to not be doubting Thomases on these PPACA exchanges. We should be doubting Thomases. We should make the federal government prove completely that these things can be financially successful, that they can at least pay for themselves before the state financially commits to any of it. Before we even consider whether we'd want to do this, prove that you can make this thing work, that the citizens of this state will buy coverage in the exchange, will continue to have coverage in the exchange, that they will like how the exchange is run before we ever consider signing on. I just can't find a compelling enough reason to get past that objection. And I know that reasonable people can disagree on this. Okay? I know that my opinion is not unanimous, but I also know that there are a lot of folks around the country that share this opinion. And again, look at the list of states of how many have signed on to do this, to either build it themselves or to do a partnership. You add those two together and it's 15. You got 35 states that haven't made a decision. And we're now getting more and more states saying, we've officially decided we're not doing it. We're up to 7 now. And I would anticipate you're going to start seeing more and more of that. But when you look at 35 states that either have said we're not doing it or we haven't decided officially which way we're doing it, when you get to the bottom line, it's really about money, because everybody knows that the deadline looming is January 1st, 2015. And because of all the issues we've talked about this morning and others that swirl around in the background, there is considerable doubt that these things will ever financially work. There is just as much of a chance that these things will be a horrible failure. And if they're a horrible failure, why should we be financially on the hook for it? For even $1. So that's That's my long-winded answer to your question. I'm a doubting Thomas.
Further questions? Commissioner, there's Representative Glassman.
Thank you, Mr. Chairman. Commissioner, but now again, you may have already said this and I didn't quite catch it, but even if the problem is money, then even if the feds run it, won't they simply charge policyholders? Now, they may not charge the state, so it will look like it's not our fault, but the policyholders will be paying whatever it costs to run it. I mean, so I'm not sure that what you say. Oh, okay, I understand doubt, and it's clearly uncertain, and 20 years from now we'll know more about it. But we're going to have the exchanges, it appears, barring your outcome in November.
I have a hunch you're not in agreement with that outcome.
And even then, I've heard stuff saying that, what are they going to do with all the other, maybe the exchanges won't be, but they're going to repeal all the items in PPACA that have 70% approval rating? I mean, I don't know. But if there are exchanges, we're going to pay for them. Maybe not the state government, but the state people are. And if the state, we know that North Dakota can do it better and cheaper. I mean we all run on that, and so the costs to all of us are likely to be less if the states are involved in running it. No,
Chairman Kaiser, Representative Glassheim, to go to that last point first, you're right. We do all run on the state can do it better, faster, cheaper. The problem is that's a mirage here. You're building a PPACA exchange, whether you as a state do it or the feds do it. The amount of difference between a state-built and run exchange and the federal exchange, or the difference between a state-built exchange in California and a state-built exchange in Maine, is going to be on the edges. Okay? These things are going to be a cookie-cutter, almost identical approach, okay? Because that's the way the law is set up. We don't have the ability to just build whatever exchange we want and call it a day. If that was the case, we'd have already done it. We would have already done what Utah has done. And we'd tell the federal government, we built our exchange just like the Utah model, approve it, check it off as good, and we're done. That's not what's going on here. We have to build an exchange that complies with every requirement of federal law. This is a federal exchange being run by the state if a state takes on this burden. And to go back to your first point, I agreed with everything you said, but the punchline is the end, okay? The state would pay, okay? And you hit on it at the end of your comments. If the state builds and runs the exchange and you get to 2015 and there's a shortfall like I outlined, okay? $2 million a month to run it, you're bringing in $1 million a month only, so you got $1 million shortfall. So you jack up the user fees on all the policyholders to try and make up that difference. You jack up the assessments on all the insurance companies that are offering products to try and make up that $1 million shortfall, okay? Which is exactly what's going to happen, all right? That's what the federal government would do too, okay? If you still have a shortfall, and odds are you will, because the more you start jacking up those fees, the more likely that policyholders will start to leave and you'll start to circle the drain downwards, and the less policyholders you have, the less insurance companies are going to want to be in this game, and they're going to want to leave. So odds are you're going to start moving in a downward direction if you're not bringing in enough money by 2015 to pay for the monthly costs going forward. The punchline is, if a state got themselves in that hole, and they still, after doing the same things that the federal government would do, has a shortfall, the state is on the hook for that. 2 words, general fund. I don't see any other way around it. General fund dollars. If the federal government does it and they end up with that shortfall, they can't come to North Dakota and say, you need to cut us a check for $500,000 this month and $750,000 the next. They're on the hook. They have to figure out what to do. So the 2 important words here are general fund. Would that ever come into play if the federal government runs it? And the answer is no.
Mr. Chairman.
Continue.
Thank you. Two things.
Is this when the debate starts?
No, I'll be short.
Because I like these.
Oh, okay. One, although the exchanges have to be the exchanges, I understand your point, it seems to me the cost of administration and the cost of bureaucracy might be less if the states run it. I mean, it's the same thing, but it's not the same thing. It's, do you go to Washington? How many people supervise? So it seems to me the states can run it. I mean, that's the point we make about states being better at it. We can run it smarter and leaner. But
Can I respond to that?
huh?
May I respond to that? This is one of the things that the states have been looking at, because initially they were thinking the same thing, because again, this is what we all run on, right? And so the states that have looked at this issue, how much would it cost to run these exchanges on a year-to-year basis based on what they would have to comply with under the federal law, not what they want to do, what they have to do under the law. The ranges are all over the board. $4 million a year, $47 million a year from some states, and some of those high numbers are from states not much bigger than us. And there's only been a handful of states that have even done the analysis. And you know why there's only been a handful? Because it's never been done before. An exchange like this has never occurred anywhere. This is the Massachusetts or Utah exchange on steroids. HGH and creatine all combined, okay? That's a PPACA exchange. So nobody has any real clue what it's going to cost to run these things, to comply with every provision of the law and make sure it's available to the consumers of their state 24 hours a day, 7 days a week. Everybody estimates and does the best they can to estimate it, but there's just as much of a likelihood that when you get to 2014 and the lights actually flip on, that it might cost more than they estimated. Maybe it'll cost less, but it might cost more. So with all that uncertainty floating around, without something you can look at and go, yes, there it is. There's some hard, solid data that we know this is exactly what it's going to cost. We can plan for that. We can make sure that the exchange will succeed to at least that number so we can break even every month. Without knowing that, and we don't, and no state does, none. Without knowing that, it's, again, all these other things, and I appreciate everything you're saying. I appreciate things I've heard from other members of the committee on this issue. I still can't find a compelling enough reason to overcome that. I can't.
That was my second question. Was you touched on it. What are we talking about, the costs? So the estimates are 4 to 10 million for a year for a state our size, or 4 to 4? What are the estimates?
I think instead of me answering that, might be a better question to either refer back to what OMB has already said during the special session, or to bring them back to see if there's any different numbers. But if memory serves me, and don't quote me on this, wasn't it something in the neighborhood of 50 FTEs to build it? Do we have OMB here?
Well,
FTEs to build it and 20 to 30 contractors.
To build it.
Build it.
Okay. So total of somewhere in the neighborhood of 50 to 55 to build it. How many to run it? Was the number the same?
It was a little bit less to run it.
Okay.
The contractors went away, but the FTEs were the same.
Okay.
but we certainly can ask for those numbers
I
again.
hate doing that.
No, but it was testimony offered during the special session. I just, again, point out that the states had an option to apply for a grant that was 100% funded. All of that building expense was 100% funded. If we decide to build an exchange after the funding goes away, it will be funded by the general fund.
Chairman Kaiser, could I just touch on that real quick? Because what you said is exactly right, and I know it's the next section in my testimony. They have consistently, as this law has rolled out, moved back those grant deadlines. And in fact, for the exchange establishment, the new deadline for states is the end of 2014, which is now the second time they've moved it back. I wouldn't be a bit surprised if we get to if the law survives and you get to 2013, 2014, and the feds are having to run exchanges in half the states in the country, they might move that deadline back again to try to entice states to do this, to move back the establishment grant funding.
And so, if it moves back, then you're okay. Representative Wise.
Thank you, Chairman. Commissioner, I just want to go back for a minute to the EHBs just to clarify something. when you talk about if they're not within the exchange, that you'll have to comply with the benefit, does that include co-pays and deductibles?
Everything that would be in the EHB package that has to be in every plan sold in the exchange is the same outside of the exchange. Once that plan is picked, it's across the board to any non-grandfathered plan. Grandfathered plans is different.
Right. So a non-exchange plan still wouldn't be able to say offer the same benefits as far as coverage, but offer a 10,000 deductible or a 20,000.
If it's a non-grandfathered plan, it's going to have to
Okay.
comply with EHB.
Thank you, Commissioner.
Representative Casper.
Thank you, Mr. Chairman. Commissioner, a couple of comments because I find your testimony very compelling. And as you know, and a lot of the committee members know, before the special session, I supported a state exchange. I have since changed my opinion, largely based on some of the things you said today and some of the research I've been doing. But one of the key things that I found to support what you're saying, and I never did question it, is the federal exchange guidelines, and I have some handouts I'm going to distribute to the committee today before we adjourn. Under Section 1311K, this was the key sentence to me. An exchange may not establish rules that conflict with or prevent the application of regulations promulgated by the Secretary. Therefore, regardless of what we may do better in North Dakota, if they don't like it or it conflicts or they don't give us permission, we're done.
Correct?
And the comment I would make for Senator Glassheim's question in the articles I'll hand out, here is some definite numbers in this article, and it's from Twyla Brace from St. Paul. The annual cost for the Massachusetts connector is $30 million. The Oregon estimate is $36 million, and the Minnesota estimate, because they're proceeding with their own state exchange, is at this point from $40 to $80 million per year to administer their state exchange. So the handouts which I have will support that data and give you information and sightings for it.
Any further? Senator Lee.
Mr. Chairman, I would just also comment that the Utah very skeletal exchange, which was established before PPACA was adopted, much less expensive. 6 people run it, and there are some functions of an exchange that also are extremely beneficial. But follow up to Representative Wise's comment, the problem here is that those options that might be much more attractive to me, frankly, I don't need to buy a policy after I leave the legislature that has maternity and fertility coverage. It's unfair that I shouldn't have that option. But the other thing is that we talk about the fact that the general fund is going to be liable if it's a state exchange, and that would be true. But if the feds don't have any money, my federal income taxes are going to go up. So whether they steal it from my left pocket or my right pocket doesn't really matter. I'm going to be paying anyway. There's my biggest frustration with the whole thing. It isn't just the state versus federal exchange choice, but the fact that we don't have any control over where the feds are going to get the money if the feds can't make it pay on its own either.
Any further? Senator Barry.
Mr. Chairman, Commissioner Ham, just so that I'm clear, the way it's set up currently, if the states elect to set up their own as of 1/1/15, going forward they are responsible, and they may not turn that responsibility back over to the federal government. May not be able to, they can't say, well, we just assume because of shortfalls, et cetera, we'd like you now to run it. Whereas if the federal government runs the exchange and it does prove to be viable, and in 2017, 2018 we decide, okay, fine, we think we can do it, and based on what is being expected and required, we feel we can run that, we would be able. The state can always step in when the feds have it, but the feds will not take it back over from the states if there's a problem. And if that being the case, and it does go 35 to 15 in terms of states choosing to run theirs and those not, as you say, they pushed back everything else. Is there a chance, have you heard any talk that they might be willing to turn that around so that if they were running the programs for 2 or 3 years, they were viable? Or excuse me, that if the states chose to run them and they were running into trouble, that they would accept them back?
Chairman Kaiser, Senator Berry, and we've talked about this at previous committee meetings, but just as a refresher, it does go both ways. You can opt in and you can also opt out. But if you opt out, if you decide to do it, and then you want to opt out later, you have to do a 12-month transition plan out, a 12-month notice period. So in that entire 12 months, you can't get out of your obligation to pay for it. But you can get out. But again, not only would you still be on the hook financially for the period of time that you're not out, then, let's talk politics for a second. You're also going to be then in a position of having to admit as a state that you couldn't make a go of it, and now you're asking Uncle Sam to come in and take over. Again, this is leading to why you're seeing the list of states where the list of states is at. And the Kaiser Family Foundation does a good job of updating this list. That's quite frankly the best list I've seen out there. There still are some problems with their list, but they've been updating this thing, geez, at least quarterly and sometimes weekly, depending on where things are happening. And there has not, the one I'm looking at right now is as of July 17, 2012, and it's not much different than it was a year ago. Okay? There's a couple more states that have made decisions since then. Quite frankly, the biggest movement on this list are the states now that have decided not to do anything. There's now 7 of those. And just, would the committee like the same list that I'm looking at? Would you like me to just run through it? Which would you prefer?
Just quickly run through it, sir.
Okay. There's, according to the Kaiser Family Foundation, and these are all jurisdictions including the District of Columbia, 16 have established a state exchange. 1 is planning for a partnership exchange. 17 are studying options. 10 are listed as no significant activity. And 7 made a decision to create a state exchange. Now, before I get to this list, the reason I said 14 and you just heard me say 16, that 16 includes District of Columbia. They're not a state. And that list that they have of 16 includes Utah. And then when you look in the footnote for Utah, they reference the statute that they passed in 2008 and 2009. That's not a PPACA exchange. And they've been told crystal clear what they're doing in Utah will not be a PPACA compliant exchange. So it's really 14 states have established a state exchange. Arizona, studying options. Arkansas, as I indicated, planning for a partnership exchange. California, established state exchange. Colorado, established state exchange. Connecticut, established state exchange. Delaware, studying options. District of Columbia, established state exchange. Florida, decision not to create state exchange. Georgia, no significant activity. Hawaii, established state exchange. Idaho, no significant activity. Illinois, studying options. Indiana, studying options. Iowa, studying options. Kansas, no significant activity. Kentucky, established state exchange by executive order. Louisiana, decision not to create state exchange. Maine, decision not to create state exchange. Maryland, established state exchange. Massachusetts, established state exchange. And by the way, again, like Utah, the footnote they have here, they refer to the Massachusetts connector statute, which is far closer to a PPACA compliant exchange, and they've indicated in Massachusetts an intent to make it PPACA compliant. Michigan, studying options. Minnesota, studying options, although they have indicated this is one of the ones where it might be a little different by executive order. They've talked about establishing state exchange, but it hasn't gotten through the legislature. Mississippi, studying options. Missouri, no significant activity. Montana, studying options. Nebraska, studying options. Nevada, established state exchange. New Hampshire, decision not to create state exchange. New Jersey, studying options. New Mexico, studying options. New York, established state exchange. North Carolina, studying options. Our own state, no significant activity. I disagree. We have all kinds of activity occurring here. Right today, Ohio, no significant activity. Oklahoma, no significant activity. Oregon, established state exchange. Pennsylvania, studying options. Rhode Island, established state exchange. South Carolina, decision not to create state exchange. South Dakota, no significant activity. Tennessee, studying options. Texas, decision not to create state exchange. Utah, established state exchange. Again, we talked about that. Vermont, established state exchange. Virginia, studying options. The state of Washington established state exchange. West Virginia established state exchange. Wisconsin, Wyoming, no significant activity. That's where things stand as of July 17. And this list has had some movement since the Supreme Court decision. Primarily, it's been states saying, we're not doing it. There have been at least 4 states since the Supreme Court decision. Maybe what I should do is I can forward the link to this website to Jen,
think
and we
we've
can
got
up. Yeah. Okay. And they do a very good job of continually updating that thing.
They do. That's my personal foundation, by the way. No, I'm just kidding. Senator Hatton.
Thank you, Mr. Chairman. Commissioner Ham, I have a question that sort of relates to what Representative Glassheim's is. If you look at a federal exchange, what do you know about the costs that would be incurred for the state itself? Are these costs going to be pooled by the feds into all one pot, and we're going to be helping pay for another state's exchange? Or are the costs for North Dakota only being assessed to North Dakotans?
Chairman Kaiser, Representative, that is an excellent question. It hasn't been sorted out. This is another one of the frustrations that states have, because as they're trying to analyze what to do, they want to know what the federal exchange is exactly going to look like, what are all the rules and regs there, and they haven't completely set those. So again, you're a little bit of the dark as to how they're going to, if they had to run it in the 20 states. So anyone who wants to do this wants it to be a roaring success from day one, obviously, because it's a business and you want your business to succeed, you want it to succeed from day one. And so the concern out there is, even if it's a federal exchange in states all over the country, if they're not ready to flip the lights on January 1, 2014, that hurts the administration. They don't want that, right? So there might be some appetite for this.
Continue.
Mr. Chairman, just to...
Doesn't change my opinion, by the way, but...
Yeah. Well, and I happen to agree with your opinion. Unlike Senator Glassheim, I didn't have the opportunity to vote on that in November, but those dates are set in the bill.
Yes.
HHS can't change them.
Correct. In order
Congress
to change
can.
it, that's why I said the lame duck Congress. You would have to get a change to the 4 corners of PPACA to allow the exchange date of 1/1/2014 to be moved back. It would have to be an agreement between Republicans and Democrats to do that. That's what, you're right. HHS could not do that on their own.
And we can't change those dates. Congress does, so we should be talking to Congress.
Okay.
Okay. Senator Mather.
Maybe we should talk.
Thank you, Mr. Chairman and Commissioner. I wonder sometimes what input you're receiving in your office. For example, this whole discussion reminds me of the interstate highway system. We didn't really know where the interchanges were going to be, which town was going to be off, which town was going to be on. A lot of unknowns. I wouldn't doubt that the majority of people in this room today use that interstate highway system. And there are rationales for an exchange that relate to transparency, that relate to equity amongst all the citizens about insurance, that relate to access to health care. And I think we have to also keep those things in mind, for the common good. And it's the same way, the same discussions when we have other public projects. There is cost, there are consequences, but there are abilities to work out some of these things. And I'm wondering, does your department have access or receive information from, do you have an advisory group of uninsured people, or an advisory group of people who can't use the insurance system, who need a transparency system, who need, our young citizens? Frankly, they want to go to a website to buy a product. They are not involved anymore in an old type of commerce. And that's part of this issue, is preparing for the next generation. And I'm wondering if you have that kind of advisory group that relates to those kinds of entities and those kinds of needs?
Chairman Kaiser, Senator Mathern, very much appreciate your comments. What we have done in the department ever since the law was passed in March, at any of the major stages along the process, we've tried to get stakeholder input. Okay, we post things on the website. We encourage folks to make comments. And among the stakeholders that get updates regarding major things happening are consumer advocacy groups. Okay, so we have done that. We also did, as you may recall, a couple of years ago, we did chat. Do you remember chat? Choosing Health Plans All Together, where we went all across the state. We brought diverse groups of people together in 13, if my memory is correct, 13 different locations across the state to let people give their direct input to myself, which we then passed on to the legislature, what should be in a health insurance plan, to give them voice to what health insurance should look like. And it was perfect timing, because when we did the project and completed it, it was right around the time HHS was starting its work as to what was going to be in a health insurance plan underneath PPACA. Because remember, when this started, HHS was going to be making the EHB decision. They've since punted it to the states, but when it started, they were going to make it. So we forwarded all that information to Secretary Sebelius saying, here's what the people of North Dakota are saying. So yes, we have done that.
Further questions? Commissioner, I have a couple of questions, and just to see whether at the NAIC you've had any kinds of discussions. I do understand that through budget reconciliation you can affect the budget, but does the federal government operate the same as our state government in that we can do things prospectively but can't do them retroactively? And specifically, let's take a state. It doesn't matter, but they have agreed to the Medicaid expansion. Right. They've submitted their letter, they've done it. The law says that the federal government will fund that for the first, whatever, I can't remember, 6 years, and then the funding decreases and goes to 90% in 2020, I believe.
2020, yeah, I think.
So, for those states that have made that commitment based on the current law, and if it gets accepted, then Congress can't cut that, subsequently cut that funding. Is that true? I mean, we can't operate that way.
Representative Kaiser, I would just be spitballing an answer to that. I agree. I think that's exactly right, but I don't have anything more firm than that. We could certainly look into that.
Well, you know, it's just a question, and maybe Maggie. Okay. But relative to anything, any action the state may take relative to ACA, otherwise there would be a lot of lawsuits from the states, right, which would in effect extend Congress's ability to repeal ACA. Right. If they've taken specific action that would have committed federally agreed to dollars, et cetera. So this is not a simple repeal. As an article in the paper indicated, under the best of circumstances, the repeal could take 9 months or more if you were able to repeal anything. So the law stays in play until that. The other questions, as you read through the states, and I was familiar with those states, I'm going to predict that a few states like Illinois and a few other states are going to choose to do a state-based, but I don't know that. But they haven't committed yet. But when you look through the states that have committed, and I asked HHS representatives at the NCOIL meeting 2 weeks ago, I said, as I look at the states that have committed, and if even just half of the uncommitted states go, they have the votes in the House to control it. Okay. So if their state is on the hook, as you suggest, for a state-based exchange, they're not going to support the federal government doing anything but assessing the states for the full fee. That it will never get back to the federal government because their state has already taken the position to be on the line.
Has the votes in the House?
Yeah.
You also need the votes in the Senate.
Well, you got to get it through both, unfortunately. So, yeah, you got the votes in the Senate to win, but with the number of states that are uncommitted, but on the states if you pick up Illinois and a few other big states, suddenly you got the House. And
Texas and Florida are pretty big.
I cannot see the House being willing to say, yeah, go ahead, my state will pay for our state-based exchange, but for those people that opted into the federal exchange, we're going to let the federal government pay their portion. I just can't see that happening.
I'm not sure that would happen either. I'm not sure the whole thing wouldn't just collapse.
Well, it might. They might just simply assess.
No, I mean collapse.
Well, it's possible, but they could assess the current policyholders or the companies that are there. Based on your experience as insurance commissioner, if we had a federal or a state-based exchange, would there be many insurance companies in our state that wouldn't have to participate in the state or the federal exchange to pick up that market share? Would there be a place solely outside of the exchange?
Well, Chairman Kaiser, and we've talked about this in previous meetings, and I did a whole presentation on this. I want to make sure that we keep that outside market alive, that it's not just the exchange where folks can go for their health insurance needs. We want that outside market to continue to exist. I agree with some of what you just said. It's predictable that to begin with, regardless of what exchange model we have, that most insurance companies are going to want to be in the exchange. Of course, they're going to hope that the exchange succeeds. There's all kinds of policyholders. They can compete for market share, et cetera, et cetera. But if it doesn't work, if it's not working for any number of reasons, premiums are going through the roof, the way the exchange ultimately works itself out, not just the rules we know now, but rules that continue to exist, make it not attractive for policyholders to stay, and policyholders start voting with their feet and leave the exchange. I don't work for an insurance company, but I can't imagine they're going to want to stick around if there's not a big pool. They'd want to leave too, and that's why it's so important to make sure we still have an outside market in the event that these exchanges don't work. And like I said earlier, to me it's just as likely that they're not as they're gonna. No one has ever tried what is about to be tried here under PPACA.
And I think on our state-based model that we did design by North Dakotans for North Dakotans, we guaranteed that there was that outside market available.
Well, the feds can't shut it down.
No.
If the feds run it, they can't shut down.
We guaranteed it.
Okay.
If the Fed exchange comes into our state, it's my understanding initially that they will not use an active purchaser model. But is it likely that they evolve to an active purchaser model if the federal program comes to North Dakota? The election doesn't work out the way some of us think it might, and it comes here, will it eventually be an active purchaser model, do you believe?
Chairman Kaiser, again, I'm just spitballing an answer here. I think a lot of it will depend on how these things actually work. Okay? I agree with you. I don't think there's any way it's an active purchaser model to begin with, just because of the time constraints alone. Just for them to actually get this thing up and running, especially if it's in half the states in the country. I think it's going to be anyone that wants to, come on in. It's not going to be an active purchaser model. Will it evolve to that if it's a federally run?
It's a risk we run, especially for our Blue Cross Blue Shield companies and others.
But remember, if it evolves to that, if it turns out that it's something that we don't like, but we like other parts about the exchange and the people of our state are responding to it and it looks like it's a success, we can take it back.
Yep. Okay.
We have that option.
So relative to navigators, if we had designed our model with 2 navigators, the minimum required, has there been any indication from HHS on the federal exchange relative to their approach to navigators?
Chairman Kaiser, I don't have that information as I'm standing right here, right now. We can certainly get the latest up-to-date information from HHS. This might be one of the things that we haven't heard on yet. The fact that I haven't heard it yet and it's not already logged into my brain tells me we might not have it yet. There are a lot of the rules and regs regarding the FFE that aren't out yet.
Well, that's one big variable. The other, and the last thing we tried to do was protect agents and brokers in our state. And do we know what approach that agents and brokers, what position agents and brokers will be placed in if a federal exchange is implemented in our state?
Well, we know they can be navigators. They're allowed to be navigators.
Yeah, but then they can't receive commission.
Well, that has always been, by the way, that's
Always
always been an open question, regardless if it's a state-run exchange or a federal exchange. That's still an open question as to whether an agent can wear two hats. Can they sell it outside the exchange and get a commission and be a navigator inside the exchange where they can't get a commission? Can they wear both hats? As I'm standing here right now, I don't think there's a specific answer to that yet. That's still an open question. And again, it doesn't on that one, it doesn't matter if it's a state exchange or a federal exchange.
Okay. And Representative Nelson.
Thank you, Chairman Kaiser. Commissioner Ham, in state responses to PPAC, we see, for instance, where companies quit selling child-only policies in North Dakota, but we saw them continue in some states where they instituted waiting periods and open enrollment periods in order to protect the companies from that liability. And we also have the talk that under PPAC, supposedly a guy could be in an ambulance and with the no pre-existing conditions that he could call up and get health care on the way to the hospital. But again, we have the ability to have open enrollment periods and such to stop that. Is that different under a federally run exchange than under a state exchange?
Chairman Kaiser, Representative Nelson, two very good questions. Let's start with the first one. The reason that a couple of states are doing this is because they're breaking the law. Okay? They're specifically thumbing their nose at what HHS said had to be done, and to date, HHS hasn't called them on it. They haven't stopped them from doing that in their state, South Dakota being one of them. Okay? We're not doing that in North Dakota because, as you remember, we just passed a statute in 2011 that said we would comply with federal law, whatever federal law is. And HHS's interpretation on the no pre-X for kids under 19, we have to follow. It doesn't allow us to do what South Dakota is just on their own deciding to do. Okay? So we can't unless we're just going to start picking and choosing what parts of federal law we're going to apply and what parts we're not. I, as an executive branch constitutional officer, am not going to do that after we just passed a statute in 2011 that said we would enforce PPACA, whatever the law is. So we have to go along with what HHS is saying, which gets you to the second part. And this is a big matzo ball. Is HHS going to take the same position on open enrollments when you get to 2014 as they've taken on children policies under the age of 19? If they do, then you're not going to be able to have open enrollments beginning in 2014. And literally someone will be able to buy their policy on the way to the hospital. Okay?
I'm pretty certain the law specifically allows open enrollment periods.
Nope. Sorry, it does not. If it did, we would do it. We looked at this issue very carefully. We have to follow what HHS is saying.
Thank you.
Yeah.
Any further questions? All right, Commissioner, you were going to also cover.
Yeah, I think I can do the last couple pretty quick, I think.
Okay, that'd be great.
Grants. I was also asked to address grant opportunities. The following chart indicates other grant funding opportunities from HHS that are still available. You can get an exchange establishment grant that I talked about a little bit earlier. The current due date is quarterly through the middle of third quarter of 2014. And rate review grants are still available. Current due dates of middle of August 2012 into middle of August 2013. So those are the two primary grant opportunities that are still available. And then lastly, on external review, I was asked to address the status of that issue. Since the last meeting of this committee, the Insurance Department has finalized its internal process for handling external review requests. The process was finalized after sending drafts to all stakeholders twice, receiving several comments, and making suggested changes. An explanation of external review is posted on our website for consumers. On May 2nd, the Insurance Department requested a second redetermination of North Dakota's external appeals process based on the fact that the only factor in determining we had not met the full obligations required for 2014 in the previous determination was the lack of record retention requirements for IROs. Because we included the record retention requirement with the 8 IROs that we have under contract, we were notified by HHS on July 10th, just a couple of weeks ago, that we are now fully compliant. And the copy of the letter from HHS is attached to your packet. It's the last document in the packet that you have in front of you. To date, we have received 2 requests for external review. So with that, that would conclude my testimony.
Any questions? The one other thing, if you could cover quickly, and I'm asking you, I guess, now to recall from your memory, but you gave the extensions on the grants, but are the other dates still in play that are specifically in the law? November 16th, January 1, 2013, October 2013. Those dates have not been changed and still must be met?
As we're standing here today, to my knowledge, those dates have not been changed. So you got November 16 is the first one coming up, where a state has to tell the federal government which direction it's going to go on the exchange. And if a state doesn't say anything by November 16th, it's assumed it's going to be a federal exchange. January 1, 2013 is the next deadline. That's when HHS has to certify states that have decided to build their own exchange, whether they are PPACA compliant. HHS has an additional option. They can say you're conditionally approved. You haven't completely complied with PPACA, but you're far enough along that you're going to be compliant when the time the exchanges are up and running. Then the next one is October 1, 2013. That's the initial open enrollment period for the exchange. That's really kind of when the lights go on. That's when folks can start to purchase policies and shop around. January 1, 2014 is the official flip on the lights, have a cake, here we go, the exchange is up and running. And then January 1, 2015 is the date by which any state built and run exchange has to be self-sustaining. Those are the dates.
Okay. And commissioners, unless I'm wrong, and I thank you for being here because you can answer it because you're closer to this. The legislature spoke in the special session, said no state-based exchange. So that option's off the table. That leaves the partnership and the default to the federal. Although the grant application deadlines have been extended, you can only access those if you have a certified plan, I assume. I mean, how could you apply for the grant if you didn't participate in the certification process and demonstrate that you would have a state-based plan?
The way it's worked up till now, you didn't have to have your complete plan put together in order to get an establishment grant. You had to be working towards a state-built and run exchange. We can confirm if anything's changed with respect to the establishment 2 grants, but I think it's the same. You have to show that you're moving towards building and running your own exchange to get establishment grant funding, which again has now been extended all the way to basically the end of 2014.
And that's my reading, but we can't do it. We can't demonstrate that because we will default on January 1, 2013.
Well, but again, if the state were to make a different decision, for example, if there were a special session, or if...
It'd take a special session. The legislature has spoken.
Correct. But again, for example, if you guys came in January of 2013 and passed a bill to build a state exchange, and then you showed that to HHS and said, we are now going to build our own exchange, we may not be ready by October 2013. We may move heaven and earth to try it. To me, that's an open question of whether or not HHS would say, certainly you can apply for grant funding and we may give it to you. That's underneath the whole premise here of, does the federal government want states to build and run their own exchanges or not? And the answer is clearly 100% yes. They don't want to do it. So my answer to that is any movement a state's going to make towards building an exchange, HHS is going to bend over backwards to give you money to do it. Because they know that's the carrot to get states to build the exchange, that the feds will pay for you to build it.
Yeah,
So
they might do it. Boy, they won't give us an extension on the essential health benefits, but they would give us that kind of extension after their deadline in the law.
sounds like now they are giving us an extension.
Well, for the states that are going forward with a state-based exchange. But maybe not. Maybe I'm misinterpreting it. Any other questions? All right, thank you very much. Well, this was another short.
40 minutes.
It was
All
a
right.
great. You did a great job. Thank you very much, committee members. We have to take a break until 11:30. We just have to do it. We'll be back in. Please be back at 11:30 so we can begin and try and make up some time. We'll reconvene the Health Care Reform Review Committee and move to our 10:20 segment. Really reminds you of IBL meetings, doesn't it? All right, the next person to appear is Tammy Turnus from the Governor's Office. Tammy, I believe, is the Policy Director for Health in the Governor's Office and is here to visit with us. Tammy, whenever you're ready.
Good morning, Chairman Kaiser and members of the Healthcare Reform Review Committee. My name is Tammy Turnus, Policy Advisor to Governor Dalrymple. I'm here today to provide information regarding the Governor's position on the Health Benefits Exchange and Medicaid expansion provisions of the Affordable Care Act. As we all know, the State House of Representatives voted 64-30 to defeat efforts to establish a state-based Affordable Care Act mandated exchange. Since that time, the governor is not persuaded that there is any reason to alter the course adopted by the House action. Therefore, he remains opposed to the establishment of a state-based exchange. The U.S. Supreme Court ruled that the federal government cannot mandate states to expand their Medicaid programs. Several critical questions remain to be answered before states can determine best how to proceed in light of the court's decision. The Department of Human Services has submitted numerous questions to the Centers for Medicare and Medicaid Services and will analyze responses as they are received. This concludes my testimony.
Thank you, Tammy. Any questions for Tammy? Tammy, Representative Glassheim.
Thank you, Mr. Chairman. Tammy, I just wonder, I know you're not in a decision-making capacity here, but just relaying information, but I hope you would communicate to the governor that I would hope that since he doesn't like this method of accomplishing what PPACA hoped to accomplish, that he will present to the Legislative Assembly next session something which provides for increasing access and decreasing costs, how he wants North Dakota to do it. If you would just communicate that hope on my part.
I think that's a comment, not a question. Are there any other questions? Tammy, I know when I chatted with the governor, and you might have been involved, I believe the governor made the comment that the Republican governors following their meeting had submitted a letter to HHS with several questions that they were hoping to have answered. Do you know what those questions were, and do you know if those answers have been provided by HHS?
Chairman Kaiser and committee members, I am aware of that. Questions have gone out, but I have not seen a response to those questions.
Okay. Because I have not seen either the questions nor the response, but HHS has indicated that they have responded.
Chairman, I can follow up and find that letter for you.
Senator Mathern.
Thank you, Mr. Chairman and Tammy. The Office of Management and Budget gave us some material earlier on about the costs of exchanges, so the Executive Office has been involved in those details. Do you continue to monitor this, or do you leave it up to the Insurance Department, or is OMB continuing a monitoring process with the federal government about issues of costs?
Chairman Kaiser, Senator Mathern, and committee members, we continue to monitor and stay in communication with our state agencies as well as our insurance commissioner. And as I stated, the governor has not seen any further information.
Any further questions? Thank you very much, Tammy.
Thank you very much.
The next item on the agenda is comments by interested persons. Is there anyone in the audience that would like to comment at this time? All right. Then we have committee discussion. The chair will invoke the privilege of the chair, and we're going to hold any discussion till later today so we can keep moving forward. It's our intention to now have Maggie Anderson make her presentation. This may take a little bit longer than 25 minutes, but that's okay. We'll go till we're concluded and then break for lunch. Welcome, Maggie.